Okay, let's dive right in. We're going to talk about a huge, kind of hidden paradox when it comes to AI in healthcare. And this title says it all. The model works, the system doesn't.
So you know the pitch, right? AI triage tools. They promise something that sounds absolutely incredible. We can make faster decisions, prioritize smarter, and deliver way more efficient care. It honestly sounds like the perfect solution for our overloaded healthcare systems.
But here's the twist. This is the question that changes everything. What if that super smart, fancy new algorithm isn't actually the problem? What if we're looking in the wrong place entirely? That's what we're going to unpack today.
So first, let's talk about that promise. Why does AI feel like such a natural fit for a job like medical triage? Well, when you boil it down, triage is really just a ranking problem. You're trying to figure out who needs help the most right now. And that's exactly what machine learning is fantastic at.
And on paper, the workflow seems so incredibly clean, so logical. You just build a model, it spits out a risk score, you use that score to resort the patient queue, and bam, you get to the highest risk people sooner. It's such a simple, elegant idea.
But this right here, this is where that simple, elegant idea starts to fall apart. Because the crucial point, and this is everything, is that a perfect prediction is totally useless if you can't do anything with it. The model's real value isn't the score, it's what happens after the score.
And that brings us to the hidden and, let's be honest, deeply flawed assumption that's kind of hiding under the surface of so many of these AI projects.
Here it is, the big flawed assumption that once the AI raises a red flag on a high-risk patient, our healthcare system is just ready and able to jump in and provide quick, effective care. But as you're about to see, that's often just not true.
Because this is the real world. Your amazing AI can flag a patient all day long, but it can't magically erase a 6-week wait for a specialist. It can't get someone a ride to the clinic. It can't fight an insurance denial. And it definitely can't solve massive staffing shortages or a follow-up process that's totally broken. These are system problems, not data problems.
So what happens is the AI model ends up acting like this incredibly powerful spotlight. It's not fixing the problem. It's just shining a really, really bright light on all the bottlenecks and cracks that were already there in the system. And this whole situation creates this really bizarre outcome, where you can have a technically brilliant, super accurate model, but in the real world, patient outcomes are still bad.
I mean, this is what success looks like in a PowerPoint deck, right? The data science team comes in, shows this chart. Look at that, 95% accuracy. The model is a huge success, everybody celebrates. But then you look at the chart that actually matters. And despite that amazing 95% accuracy, patient outcomes have barely improved at all. And why is that? It's because being better at finding the need doesn't automatically make you better at meeting the need.
And this really gets to the heart of it. It's this quote right here. Identifying risk is not the same as reducing harm. An algorithm is great at the first part, but only a functioning system can ever do the second part.
Now, this problem gets even more intense, even more challenging when we zoom in on public health systems specifically.
Because public health systems are just constantly grappling with all of this stuff. We're talking chronic underfunding, huge gaps in data, rigid policies, deep structural inequities, and sometimes a real lack of trust from the very communities they're trying to help. So in that kind of environment, the real bottleneck is never the algorithm. It's the capacity to actually do something.
And there's a dangerous side effect to all this. We can get caught up in what's called technological optimism. We get so excited about the shiny new AI tool that we use it to distract ourselves from the much harder, much less glamorous work of actually fixing the broken system underneath.
So what's the fix? Well, the solution really starts by reframing the whole problem. We have to stop thinking of this as just a modeling problem and start treating it like a deployment problem. We need to ask better questions.
It starts with this. Be super specific. The AI produces a score. So what? What exact action is supposed to happen next? Is it a phone call, a clinic appointment, a text message? What is it?
And then you have to ask, who is the person responsible for taking that action? And what's the timeline? Are we talking minutes, hours, days, or weeks? That how quickly part is absolutely critical.
And finally, you get to the really tough ones. Does that person or that team actually have the capacity, the time, the money, the resources to do the thing they're supposed to do? And what kind of constraints are they dealing with?
Once you start honestly answering those questions, it all leads to the one big lesson, the real key takeaway for anyone trying to use AI in healthcare.
This is the mental shift we all need to make. The common belief is that AI fails because the model wasn't good enough. But the reality, way more often than not, is that the AI fails because the system was unable to turn that amazing prediction into actual care.
And that leaves us with this final, really powerful thought. For data science to actually work in public health, it can't just be about building cool models. It has to also be system science. The two things are totally inseparable. Your algorithm is only ever as good as the system it's plugged into.
And that's our explainer for today. Hey, if this gave you a new perspective on AI, do us a favor and hit that like and subscribe button. It really does help us out. We'd love to hear from you in the comments. Have you seen this play out in other fields? Let us know. Thanks so much for watching.